PERIO, PERIO, PERIO. The class that you hated the most, but is actually the most evidence-based and literature-based specialty on the planet. That's right, PERIO, where millimeters matter. And what matters is getting into a PERIO program too for some of you. So stay tuned as we talk to a doc who just got into PERIO and he's going to be sharing life as a first-year PERIO resident. Stay tuned. Hey, this is Dr. Darwin, new dentist coach, with another episode of the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, surviving residency, and then life as a new dentist. Guys, thanks so much for joining us. Be sure to stay tuned and stay throughout this whole entire episode. We got some really good gems we're going to be sharing today. Also, this episode is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, which is a resource for you to help you get into the residency program of your dream so that you can launch your career and get that payoff, whatever that means for you. But you can do it this cycle. For more details, go down below, GetIntoDentalResidency.com, and we look forward to helping you match this cycle. So today we're going to be talking to a doc who has kind of shifted his focus from general dentistry to now into periodontics. We're going to be joined today with Dr. LeRoy Horton. How you doing, Doc?
Yes, sir. I'm doing well. How about yourself?
I'm doing great, man. Congratulations on your recent match into PERIO, which is, a specialty not many people think about diving into.
I appreciate that.
Yeah. So before we get started, let's have everyone get to know you a little bit better. Please introduce yourself for people that are meeting you for the first time.
Indeed. So my name is LeRoy Horton. I'm was formerly a general dentist practicing in the greater Seattle area. I went to the University of Washington School of Dentistry. Way back in the day, I graduated in 2007, hence all the gray hair that you see in my beard right now. So I'm definitely your non-traditional resident, as I practiced for a very long time. My niche coming out of dental school as a GP was surgery. I did some extra surgical training while in dental school. And so I kind of geared my practice towards wisdom teeth, IV sedation, implants, and implant-related surgeries. And it all culminated to me eventually owning 2 offices and having a number of associates and just kind of bouncing back and forth doing mostly the specialty work within my patient pools. And at some point, I just decided that what I wanted to do is, in my midlife crisis age, instead of buying a Corvette, I said, let me pursue a passion of mine, which was implants, which was developing curriculums and teaching, and diving into research. And, doing a PERIO residency kind of checked off all those boxes for me. And I was able to sell my offices and have a nice little nest egg of savings to kind of bridge me through these 3 years of residency. And this is where I'm at.
That's awesome. What kind of segues to the second question, which is why PERIO? Why PERIO for you? It sounds like, you mentioned your passion, evidence-based, developing curriculums. But there are some other specialties where you can do that as well. So, but why PERIO?
So for me, my passion over the last 12, 13 years of practicing has always been implantology. And so a lot of the CE courses and extra training that I was doing happened to be taught by periodontists. I had pursued a certain amount of accreditations through the International Congress of Oral Implantology. So I first started with my fellowship, and I got my mastership, and then eventually my diplomate status, which was a board certification in the field of implants. And I really realized, as the more that I worked with colleagues that were specialists themselves, usually periodontists or oral surgeons, that having a command of the literature, having a command of the research, both old and new, that's kind of, the new innovative stuff that's coming out from the research field, was just something that I really wanted to be a part of. I wanted my legacy to transcend just the working on individual patients or working in my community, to really leave a legacy within the profession itself. So I felt that transitioning to academia and research was a way to do that. And it happened to be that a lot of the periodontists that I had learned from seemed to have the greatest command of that knowledge and literature, and were very masterful in how they presented it in a way that was very inspiring. And so when I was thinking about, what type of specialty to transition to, perio was just the easy one for me, given my history and background,
Right.
given my pre-existing passion and experience with implants. And like I said, whether it was, I think both Salama brothers, Eddie Salama and Marie Salama, periodontist.
Dental XP
Yeah, I've been on their
out of Atlanta.
platform for a while. I've done a
Yeah.
number of their master's courses that they personally taught. Dr. Jin Kim out of California, he's the director of the Global Dental Implant Academy, and by far one of my favorite lecturers. So periodontist just always had an influence on me and my professional development. And so
Gotcha.
that was just an easy choice for me.
Gotcha. So once you've determined that perio was going to be your jam, so to speak, then comes the whole application process. So share with us how you prepared for the application.
Well, I went to Adia Pass, who is like the clearinghouse where you enter all your information in. And then you kind of link all your people that are going to be writing your letters of recommendation. And things have changed from years prior that I remember, even my application process. So it's no longer a standard letter of recommendation. They have to log on and fill out specific questions about you. A letter of recommendation helps to build a framework. But what I did is I got in touch with people that I knew intimately, that I knew could really express my story of where I've come from, who I am, what I bring to the profession of perio. And I was very conscious of who I chose based on their communication skills, right? You can have the most gem of a person that loves and adores you, but if they can't communicate how great you are, then they're not really fitted and suited for being your, providing that recommendation for you. So I reached out to a number of friends, colleagues that I've worked with and have had relationships for years. One of them, my mentor and good friend, Doug Jackson. One of my good friend and amazing prosthodontist, Richard Ansong. People that have seen my work, but that also have a more intimate knowledge of who I am. And then, you go through the process of filling out all the questionnaires, getting all the original copies of your transcripts. You have to get official copies of your board scores sent over. So there's a pretty intensive process that you really have to be organized to get through. It's not just saying, hey, I'm a dentist, here's my application. It's not a there's a lot of hoops you have to go through to be able to apply.
Well, it sounds like the key thing is really making sure that you zero in on people that can represent you the best, those that can write you a strong letter of recommendation and can communicate who you are as a candidate, but also a professional, but also as an individual as well.
Absolutely. And the thing that's different from residency as compared to getting into pre-doctoral programs is they are going to be intimately working with you day in, day out. Most residency programs are a very small cohort, right. And it's often not a large admissions committee that has people from different departments, community members, and so forth that are selecting you. It's the faculty themselves.
Right.
So it's a small circle of people that are going to be selecting you. So they need to know who you are.
Right.
That's why it's really important to select people for your recommendations that can really express not just your resume and your CV, but can really attest to who you are as a person and what type of energy, what type of contribution, what type of passion you can bring to a very small program that, you're going to be intimately involved with everybody for the next, 2-3+ years, depending on which residency program you're applying to.
Yeah. Key word, intimate expressions. The ability
Yes,
to intimately express who you are. That's
absolutely.
key. That's tip number one. You guys are listening. Watch it. Write that down. Intimate expression. Who can intimately express and communicate who I am as a candidate?
Absolutely.
Who knows me best? So after you do that, now you've got to be on your best to come up with a list of schools. Well, probably you've done that already before you start your application. You're starting that process. So let's talk about how you came up with your list of schools for Perio and why. Like, what were some of the things that led you to come up with this list?
Yeah, so I was a pretty non-traditional student in that I'm not coming fresh out of dental school. I've kind of have an established life here in the greater Seattle area. So for me, I was restricted by geography because my mother's here, my mother-in-law is here, my kids are here, my family, my in-laws are here. So I didn't really have the freedom to be able to jet set across the country if that's what it came to. So for me, it was primarily West Coast schools with heavy emphasis on obviously the University of Washington, since this is my area, or Oregon Health Sciences, since it's only about I live in Tacoma, Washington, which is about 2.5 hours away from Oregon Health Sciences. So those are the two most doable programs for me. I did apply to UCSF, and I believe that was it. It was just those three, primarily to stay either in Northwest or Northern California or Northern-ish California. So those were my kind of geographic restrictions given my particular, station in life right now.
Okay, awesome. So next is interviews, right?
Mhm.
This is probably the most important part of the application. It's your first and last time to make a first and the best impression. Uh,
Indeed.
Typically either face to face or even virtual, right?
Right.
So let's talk about interview day and the interviews that you got and any strange or particular questions that maybe you were like, I didn't think they were going to ask me that.
Right. So I'm a big proponent of preparation. All right. So knowing that everything was virtual this year, I did trial runs of where I'm going to set up my computer, the type of lighting that I'm going to have, the type of audio and connection I'm going to have. So of course, I went and bought a good microphone so that my audio is nice and clear, a good camera so that it's the 4K. My skin is shining in 4K. I got a ring light. I was very prepared in that sense. As far as the interview questions, I had some friends and colleagues that have been on admissions committees before, so I just did some mock interviews with them. And I've mentored a lot of students over the years, and that's the one thing I always drive home as they approach their interviews is you have to practice, 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 right? Not that you want to be able to rattle off some, obviously pre-planned question, but you want to get comfortable. You want to work on your diction. You want to work on your mannerisms. And now that we're in an age where you can record yourself, I have a lot of my mentees recording their mock interviews and then rewatching them and just seeing, what are your mannerisms like? Do you have any nervous tics? So there's a lot that goes into preparation, which I did. When it came to the interview time, I had only interviews at University of Washington and Oregon Health Sciences. And I was actually very surprised by the style of interviews by the two different schools. University of Washington was, not to disparage them, they were rather unorganized in how they ran their interview. A lot of the faculty that were interviewing me, because it was 8 sequential interviews via Zoom, that lasted about 15 to 20 minutes. And then there was some structured, what they call happy hour, where you meet with all the current residents and some general introductions to the whole group of the cohort of applicants at the same time. But some of the faculty were reading my CV and resume and application in real time as we were talking in the interview, which I was a little let down.
For the first time?
Seriously, you know, I mean, they're,
man,
as we're talking.
What kind of preparation is that?
Very little. But Oregon Health Sciences was the exact opposite. Every person that I interviewed with already knew my entire history, where I was from, my experience. That actually thought of ways to tailor my 3 years with them, given my history of experience. So I think 3 of the faculty already had ideas of how they could utilize my experience within the program. And it was just so organized. It was so personalized that and the way they approached it, it was really as if they were thankful that we were interviewing, as opposed to having an air of, well, why should I give you a chance?
Right. And that's key, because I tell candidates all the time, you need them, but guess what? They need you.
Absolutely.
Because if you don't put them down and rank them, then they've got 3 slots that are open and they don't have a program for that year. So they need you too. So it's got to be a win-win.
It's symbiotic.
Yep.
And Oregon Health Sciences really embodied that. And I was very pleased from that experience. Some of the questions that I got with the University of Washington interview, I got the same question all 8 times, which was, why PERIO? Same exact question. So mind you, by the second or third time, I mean, I'd already practiced that question, but you know, by the end of it, I mastered the answer. Whereas Oregon Health Sciences, every person that I interviewed with approached the interview with a different set of questions, examining a different aspect of my life. So they were even choreographed in how they were interviewing and what aspect of the interviewee's life that they were examining. And I just thought that was wonderful. That was just such a great experience interviewing with them.
Did you
and some of them were questions like, you know, if you could have dinner with, you know, 1 or 2 people dead or alive, who would it be? And, you know, stuff like that. Other ones were very specific to my experience, you know, pointing out something that maybe they read in my personal statement and asking, you know, how that would affect my time there. Obviously, me being older and experienced, there was the question of, you know, how do you think you'll be able to fit in and transition from being in private practice to now being a student again? But luckily at Oregon, a lot of the faculty there went back and did their residency after a number of years of practice. So they understood and they could identify themselves with the process and the transition, because it is different going back from, you know, whether you're going straight out of school and you're still a student, all you know is a student life, to now you're, you know, you've been practicing for a number of years, you're established, you have your own personal and professional identity. To go back and be a student again, you know, it's quite a transition.
Any questions, literature-based, evidence-based questions?
You know, luckily, no. I did have one of my cohorts, Dr. Umer. He said that one of the faculty asked him, you know, what inflammatory cytokines are upregulated in smokers. And he just said he had to laugh and say, I don't really know. I think it might be this. He just tried to pull out some cytokine knowledge.
I would have pulled this out. Hold on 1 second. Let me cytokines, peri-inflammatory. Here it is.
Right.
Because that's what you're going to be doing as a resident.
Absolutely. Yeah. So luckily, I think a lot of them, for me, they were more interested in my story and my story arc.
Yeah.
Because I was a non-traditional applicant. And so I think that took up the meat of a lot of the conversation, was diving deep into that.
Yeah. Yeah. Okay. Cool. So 2 interviews, 3 programs. Now you've got to do the old rank list. A versus B, one versus two, two versus one.
Right.
What were some of the things that helped you rank your programs?
Well, for me, it was definitely the experience of the interview, and Oregon Health Sciences shot to the top of the list just based off of that. Right. I've known both campuses intimately because I went to the University of Washington. For all these years I've been an affiliate instructor at the University of Washington, so I'm a regular presence there. They know me, and I know the campus. I know the culture, the environment. I've done some training. I did my IV sedation clinical training at Oregon Health Sciences, so I'd been there before. They have an amazing campus, but for me, it was really an emotional toss-up as well. Right, the Greater Seattle community is my community. I did not want to leave them. My kids are here, so I didn't want to be too far from them. So I settled on this compromise, and I told myself, here it comes. Here it comes. You often have to make these calculations in your mind, because you're always torn between the different strings that pull you in life, right? Your family responsibilities, your community ties, your own personal aspirations, and so forth. And so I said to myself, all right, it would be much more convenient if I went to the University of Washington. It's a 35-minute drive. There's public transportation now with light rails and the train system. It's really easy, and I can still be at home with my kids, close to my mom, and so forth, 7 days a week. So that's a no-brainer. But Oregon Health Sciences really has the program that I want to be a part of. It has the academic community I want to be a part of. So what I did was I said, well, I'll rank University of Washington 1 and Oregon Health Sciences 2. If I get into University of Washington, I'll be able to justify it to myself that even though it wasn't necessarily the number one program in my heart and mind, I did it for a noble reason, right? It's still a good program, but I'm close to home, close to my kids, and so forth. If I don't get in, because, they have the algorithm that matches you, so it's not always in your power exactly, which school you end up at.
Right.
If I don't get into University of Washington and I get into Oregon Health Sciences, I can at least look at my kids in the face and say, hey, I tried to do the local thing, but duty calls, I have to go 2 hours away. I'll still make it work. It's a little bit more inconvenient, but I did try my best to be close to you. And I really, being able to say that to my kids with an honest, say it honestly to my kids really meant a lot to me, because I would never want them, especially my son, my two older ones, they're older, one has their own condo, one lives on campus in college. But with my son being 16, I value my time with him and my presence around him. And so I really wanted to be able to look him in the face and say, son, I did my best to stay as close as possible, but I'm back every weekend. I'm back at least one day during the week because it's only a 2-hour drive. I'll make this work, but I tried. So I did rank UW as 1 for that reason, and Oregon Health Sciences as 2. I ended up matching at Oregon Health Sciences, and I'm very, very happy that I did, because it's, like I said, it's the program and the culture that I really wanted to be a part of.
Congratulations, OHSU. Did I say it right?
Sir. Yes, sir.
Well, they got a dandy when they match with you, so that's great, man.
I appreciate
Congratulations. That. Congratulations. You
Thank
know what?
you.
And as we're talking about ranking and matching, people have this anxiety doing this whole process, from preparing your application to getting the letters of recommendation to getting interviews and getting prepared for that, and then after the interview having to fulfill their obligation by ranking the programs and then sitting and waiting for match day.
Yes.
So you've been through all of that through this process. So the ultimate question is really about tips and advice for people who are now going through this process or will be going through this process. So knowing what you know now and having had this journey to PERIO, what are like 3 or 4 tips or some advice that you would give applicants for this process?
First of all, I would say it's very important that you research the specialty you want to get into. we often have these kind of romanticized, idealized notions of what things that we haven't actually participated in entail. And so you owe it to yourself to do some due diligence and research and dive into whether it's shadowing. A lot of programs have externships that you can do at the university. Like I think University of Washington has a year-long oral surgery externship that you do. As a general practicing dentist, you spend a fair amount of time, kind of being around the residents, seeing what residents' life is like, at that institution. Second of all, I would say make sure you're well prepared on, as I stated earlier, knowing who you want to be your advocate during this process. So when you reach out for your recommendations, you really want strong advocates that can communicate well, that know you both professionally and personally, can speak to your strengths and your attributes. Third, I would say you have to believe in yourself. And that's key. And I know that might sound cheesy because, it's kind of cliche, but the reason I say it is very practical. If you can't sell your self-belief, you can't expect other people to believe in you. So when you're doing your interview, you have to have an honest, earnest belief that you belong where you're trying to go.
Yep.
That you deserve to be there, that you're qualified to be there, and that you bring value to whatever door you walk through. And that's something that takes practice, because a lot of us, in attempts to either to have humility or to be humble, or maybe it's not our personality type to have that kind of strong, assertive belief in ourselves. You really have to practice that, because your interview is your chance to market yourself.
Yeah. And people, don't want to say, oh, I don't want to toot my own horn. Well, you still have to present yourself, because they want people that are confident and people that have the ability to say, yep, me. Why me? Because of this, but also because, I want to become a board certified periodontist. And this is the reason why I like this program, because I see it's a good fit for me. And this is what I'm going to contribute. So
Yes.
People who are able to communicate and articulate that and are comfortable doing it, but also know that that's what they're looking for. That's what programs are looking for, right? They're looking for people who are going to be able to take all this information and run with it and have enough discipline to understand I got to communicate when I need help. I got to communicate when I need to speak up about something, right? So all of that is things that you need to share with the committee and the people that are going to be training you for the next 2 or 3 or 4 years, depending on your program. So any other tips, advice? What's one more?
I think what's very important is projecting your life out for the next 5, 10, 15 years, right? I think a lot of faculty are also looking for that plan or potential plan that you have when they're interviewing you.
Yep.
So they might ask you, well, what does life look like for you after graduation?
Yep.
Do you just want to work? Do you have interest in research? Do you have research in academia? And that's something it's a good exercise, not only to be able to express during an interview, but also for yourself.
Yeah.
I have the benefit of life experiencing and knowing, having a specific plan that I developed, years before I even applied, thinking about the sunsetting of my career and how I wanted life to look like when I'm, 50, 60, now that I'm in my 40s. But a lot of young students don't necessarily have that. And they may not have a wealth of insight and life experience to be able to develop that. But it's a good exercise to really start thinking about it. Start writing down, what do you want to be, if you're in your 20s? What do you want life to look like when you're 30, 35, 45, and so forth? That way you can tailor your 3 years in the sense of PERIO, or however long your program is. You can tailor that experience to foster a good foundation to then make that projected vision a reality.
Yep, there you go. Know where you want to go before you go there.
Absolutely.
Right.
And then you can reverse engineer the process once you have that long-term vision.
That's right. Well, we have seen the vision today. the vision on how to match in PERIO. And we thank you so much for your tips, your advice, and sharing your journey. Guys, check out the rest of these videos here. Hopefully these will be helpful to you as well. And Doc, thank you so much. And that's our time. Love, peace.
All right. Thank you.
Smiles. We'll see you on the next video. Congrats.
Thank you.